Hi, I'm Brenda Orozetti. I'm nursing faculty at York University. We have a series of interviews today to discuss a variety of nursing roles. And the purpose is to show these videos to our nursing students so that they can learn about these different nursing roles. So I'm here today with a friend and colleague, Mavoy Bertram, who's worked in a CCRT role at Sick Kids Hospital, which is the Critical Care Response Team role. So thank you today for coming, Mavoy, to talk to our nursing students.
Thank you, Brenda. So just to highlight some key information in regards to the Critical Care Response Team in terms of roles and responsibilities and the qualifications that are required as a nurse. So this is a physician-nurse team that provides an integral connection between hospital wards and the critical care unit. At Sick Kids, the team consists of a registered nurse and 2 physicians, a resident and a fellow. So this team provides 24-hour support service to hospital units, which includes providing patient assessments, providing advice on the management of patients, and also stabilizing those patients. Additionally, patients that have been discharged from the critical care unit are reviewed by a member of the team, whether it be the nurse or one of the physicians, within 12 hours of discharge for 48 hours. So patients are seen at minimum once per 12-hour shift for 48 hours. If more reviews are required, then more reviews are conducted. So as a member of the team, I have been involved in conducting these assessments. So I would go to the unit that this patient is housed, conduct an assessment, ensure that there is whatever plans we had instituted from the critical care unit are being carried out. I would also ensure that I communicate with the primary care provider for that patient as well as the primary nurse to relay any concerns that I have based on my assessments and to find out whether or not they have any concerns about that patient as well. Additionally, then I would provide recommendations based on my concerns if it's within my scope of nursing practice. If it's outside of my scope, then I would, in consultation with the physicians on the team, we would provide recommendations for the management of this patient. I have also been involved in managing acutely ill patients to prevent admission to the ICU. If patients do need to be admitted to the ICU, though, we want it to be done in a timely and safe manner before activation of a code blue is required. And the critical care response team is the team that provides leadership when it comes to resuscitation events within the hospital. Finally, the team also provides multidisciplinary education to the wards. And over the years, nursing has really taken the lead for this. The nurses on the team have provided educational support to nurses on the wards so as to improve patient outcomes and to enhance nursing knowledge. For instance, in terms of management of a septic patient, we know how important antibiotic therapy is. If antibiotics aren't given for each hour that there's a delay, the statistics show that there's a 6 to 8% in the increase in the risk of death. So, excuse me, so our role as a nurse would be to inform nurses on the team, or nurses on the ward, that it's important that we get antibiotics into these patients that are septic ASAP and not waiting for it to come from pharmacy for 2-3 hours, because that will likely have a negative impact for patient outcomes. Or when we're thinking about code blue status for code blue activations, for instance, what can the nurses on the ward be doing while the medical team or the CCRT team is coming? If it's a patient that was not on any sort of monitor, and ensuring that patient is placed on monitor, IV fluids are drawn up, the crash cart is ready, and trying to anticipate what medications would be required for managing that patient so that care can be carried out in a timely manner. And the critical care response team also provides team debriefing post these resuscitation events so that we can further improve our practice and again improve patient outcomes. In terms of qualifications, so one needs to be a registered nurse with a baccalaureate degree We do have nurses on the team that are diploma prepared as well, and nurses must be registered with the Colleges of Nurses of Ontario. A 5-year minimum experience is required within the critical care unit, and one must also maintain a position within the unit. So if it's whatever percentage that is, you have to be involved in both roles as a bedside nurse and as a member of the critical care response team. And in other skills that are required, sound critical thinking skills, problem solving skills, and also very good interpersonal and communication skills, and being able to work within a team. So these are just a few of the highlights of the critical care response team. I hope it's been interesting for you. Thank you.